Dr. Ferrer, we are live. You may begin.
Good evening, and thanks so much for joining us for this virtual
Buenas tardes,
town
muchas gracias
hall
por acompañarnos.
on air quality, soil, water, and safe cleanup after wildfires. I want to start by expressing my sorrow and my deep condolences to all of you who have suffered tremendous losses from these fires. Our hearts are with you, our prayers are with you, and we're hoping that we can be of help both tonight and in the many, many weeks to come as you go along a recovery journey and your healing. I also want to offer my gratitude to our two committed elected officials who have been working tirelessly on behalf of residents impacted by the wildfires. I want to call out Supervisor Lindsay Horvath, who will be joining us tonight, and Supervisor Catherine Barger, who's represented here tonight by her health deputy, Anders Corey. Both supervisors, along with the rest of our board, are dedicated to ensuring that those that are affected by the fires receive the resources and the support that's needed to recover and rebuild. Their leadership during this challenging time has been essential, and I personally am grateful for their unwavering commitment to our communities. Tonight, we're also fortunate to have a panel of experts from various fields who are here to share their knowledge and answer your questions. These panelists represent expertise in air quality, soil safety, water health, and environmental science. Each of them brings a wealth of experience and dedication to protecting the health and well-being of all residents. These experts are uniquely equipped to provide the guidance you need and to help answer some of your questions. And I will be introducing them shortly so that they can share valuable insights. To start, I want to give you an overview of how we plan to run the town hall. We will begin with some brief remarks from our panelists, and then we're going to spend the rest of our time answering your questions. Many of you sent in questions ahead of time, and thank you. We appreciate it. We got hundreds and hundreds of questions. We're trying to group them by categories of questions. So if we don't get to your exact question, hopefully we're getting to a question that's on a pretty similar topic. And as a reminder, you can also send in your questions in the chat on YouTube, Facebook, or Twitter the entire time that we're together tonight. As displayed at the bottom of your screen, we have Spanish translation services during our event tonight. Para escuchar en español, por favor, llama al 1-800-805-1150. Muchas gracias y bienvenidos. Before we move to opening remarks from our panelists, as always, public health is committed to providing the best possible information to help residents stay informed about the risks and how to protect themselves. This commitment extends beyond the immediate aftermath of the fires. We're also focused on ensuring safety and health over the long term. We achieve these goals through our partnerships with local, state, and federal agencies, as well as with community organizations and all of you. Together, we'll work hard to address your concerns and to build strong, healthy communities. I do look forward to answering your questions tonight. And now it's my pleasure to introduce Los Angeles County Supervisor for the 3rd District, Lindsay Horvath. Supervisor Horvath has been a strong advocate forever for all of the residents that live both in her district and across the county. But I want to note that her leadership has been instrumental, courageous, and powerful for the residents that have been impacted by the Palisades fire. And she has worked tirelessly to insist that recovery efforts are swift, effective, and centered on the needs of the community. Her leadership is instrumental in addressing both the immediate and the long-term challenges that are posed by the fire. And I and the rest of our county is grateful for her commitment to protecting the health and the safety of all of our residents, with a particular focus on those who live and work in the 3rd District. My pleasure to turn this over to Supervisor Horvath.
Thank you so much, Dr. Ferrer. Thank you to everyone who is joining us here tonight. I think, especially after the COVID-19 crisis, I think we all hoped that we weren't going to be back in Zoom boxes like this, having to gather and talk about this kind of critical health information. And yet, because we have just done it and because we made it out successfully by working together, we know that this partnership represented in the conversation here tonight, and the partnership that is offered by our amazingly resilient residents and community members will be the reason that we are successful in recovery from these devastating fires and all of their impacts. As we move through the immediate devastation of these fires and transition to our recovery process, safety is our top priority, and public health is ensuring that communities have the resources and the information that we all need to stay safe, to stay informed, and to take care of one another. And debris removal, as we know, has started. That's a critical component, making sure that we are removing what remains from this fire from our communities. But that process also brings with it potential health risks. Exposure to ash, smoke damaged materials, contaminated water or soil, all of this can be dangerous to our health and to our environment. Proper precautions are essential before going back into homes that still remain or starting any of the cleanup process. And public health has been working tirelessly to support our community members throughout this recovery process. And they've been a critical component to how we've been thinking through both this immediate phase of debris removal and how we safely help welcome people home. Teams have mobilized quickly to share vital safety information and resources. I've personally witnessed our Department of Public Health officials and team members sharing PPE, including masks and gloves that have been widely distributed as people have been returning to their communities. And while we know air and water quality testing is underway, and we know experts are monitoring the conditions closely, we also know soil safety and cleanup guidance is being provided to ensure a safe and healthy return home. Outreach efforts, including distributing resources, answering questions, and coordinating with local leaders, are all essential components to how we will stay connected with one another. I know people are desperate for reliable information, and in the absence of it, we get in sort of these informal communication chains with one another, and sometimes they can be more anxiety-inducing than anything else. And so we at the county really want to make sure that we're providing you consistent, reliable, trusted information that you can turn to and ask those questions that are sitting heavy on your heart while you're thinking about how you rebuild your household and your community and make it safe for every stage of life. And tonight's town hall is a part of public health's commitment to transparency and accessibility for our communities. We have experts here to provide real-time information to answer many of your pressing questions. And we have resources available on air, on soil, on water safety, and public health is here ready to assist with cleanup guidance, as well as any protective measures. We know that this process of recovery is challenging, and wherever you are personally in that journey, I know a lot of people are angry and frustrated, and how could you not be? You're suffering in ways that are absolutely unimaginable. And so just know that we are here in our 3rd district office and in all of our county departments to stand at the ready with you. I know my colleague, our chair, Supervisor Barger, is here to support and take care of you, and her amazing team is doing the same. And it's a rapid response in cooperation and partnership with each and every one of you that will help move us through. So thank you for joining us tonight, for giving us the opportunity to answer your questions, to earn your trust, and to be your partners in this recovery process. Thank you very much.
Thank you so much, Supervisor Horvath. We're honored to have you join us tonight. It's also my pleasure to introduce Anders Corey, who's the Health Deputy for Supervisor Catherine Barger. As you know, Catherine Barger is a steadfast advocate for all the residents across this county who demand, and she demands that government be responsive to their needs. Her leadership has been extraordinary during these past few weeks. And we are grateful and want to thank her for her unwavering commitment to supporting the affected communities, prioritizing their recovery and their access to vital resources. Under her leadership, efforts have focused on ensuring health and safety for all residents during these challenging times. And now I'm really thrilled to have Anders Corey. I mean, for how much we love our supervisors, I want to also say we love and feel very blessed to work with their teams. And, you know, those of us who are privileged to work in this county really enjoy tremendous support and wise counsel from the supervisors and their teams. So it's a great pleasure of mine to introduce Anders Corey to make some remarks on behalf of the supervisor.
Thank you, Dr. Ferrer, and thank you to the entire county public health team and the experts we have here for convening tonight to really be a resource on so many fronts to our community. So thank you again for pulling this together. And thank you, Supervisor Horvath, for your leadership and your partnership to Supervisor Barger as we collectively respond to this and ensure all county residents, both in the impacted areas and across our community, get the public health information and resources you deserve. As again, Dr. Ferrer said, my name is Anders Corey. I serve as Health Deputy to Chair of the Board, Supervisor Catherine Barger, who, again, her commitment has been consistently to collaborate with all supervisors, especially Supervisor Horvath, and bringing all of our county departments together to be at the beck and call of all of our impacted residents, focusing primarily in our district on the victims of the Eaton fire, but at the same time, this is a partnership when we're collecting our resources, and that's what we're here to do tonight, to serve all residents of the county. I want to start off by saying we hear you. We know your needs are unique. We know the questions you have and the situations you're all on are a wide array, and you deserve to have specific answers to each of your specific circumstances that you find yourselves in. As many of you have been impacted in different ways, in tragic ways, and devastating ways, you need and deserve the most comprehensive information to make the best decisions for you and your families. We understand that while the situation is dire on many fronts, lack of information, not knowing where to go, lack of clarity can make this even more challenging. And that's what we're here to do tonight, to provide as much clarity as we can. Right now, as Supervisor Horvath mentioned, our main priority on the ground is ensuring that debris removal can happen in a safe and efficient manner. And that's on a wide variety of fronts. It's ensuring that as residents return to their properties, they have the resources and tools to safely look for valuables, to safely help their loved ones and neighbors search their properties. But at the same time, ensuring that as debris is cleared, it's done in ways that doesn't impact neighbors or residents that are still in the community. And public health is acutely aware of this. While they're providing broad guidance to all residents, they also continue to be on the ground day in, day out. This goes back to day one of evacuations, providing acute health care and primary care services to evacuated residents all the way through still being in the community, providing PPE to impacted residents and answering all questions. I know many of you have probably interacted with our Department of Public Health team in the community, who's not only provided PPE, but answered a wide variety of questions, and they're in this with us. And while public health, the Department of Public Health will continue to be the lead on the ground in the community, Supervisor Barger will continue to ensure there's constant collaboration with our state and federal agencies who cover a wide variety of expertise, including AQMD for air quality, the California EPA, the federal EPA, state DTSC, so many more that play a role in ensuring that your health is protected each step of the way as we go through this recovery process. And as we move through the recovery process, while tonight's town hall is going to be essential to answering your specific and acute healthcare questions at this time, we will continue to provide you updated information along the way. For those on the Eaton fire side, Supervisor Barger is hosting Monday afternoon virtual town halls or Monday evening virtual town halls, where we pull all of our stakeholders together, including public health, to answer as many of your questions as we can. That's going to continue until we get you all home. This public health guidance will continue to be updated progressively as the situations and the dynamics change. We will ensure that public health hears your questions and hears your concerns. And again, we know that each of your situations are unique, and we'll continue to do our best to ensure that you get the most specific, helpful, and actionable information that you need. So you can rest assured that Supervisor Barger is going to continue to be your advocate and champion, as well as Supervisor Horvath in that partnership, and as well as our public health team, and all the county resources are at and continue to be at your disposal. So just rest with the guarantee that our goal is to get all residents home safely, healthily, and as efficiently as possible. So thank you again to the public health team for hosting. Thank you all for joining, and we're looking forward to hearing your questions directly.
Thank you so much, Anders. Again, we appreciate all of your wise counsel and support. I'm going to turn now to our panelists with expertise around the science of responding to fires. I'm going to start with Dr. Davis, who serves as the Los Angeles County Health Officer, where he provides expert guidance on public health risks and how residents can protect their health and well-being. This evening, Dr. Davis will very briefly discuss potential health risks that are associated with large wildfires, what current air and watering monitoring efforts are showing about possible exposures, and the precautions debris removal teams are taking to prevent the continued spread of hazardous materials. Dr. Davis, welcome.
Thank you, and good evening, everyone. Thanks for being here tonight. I want to take a moment, as mentioned, to discuss the public health risks associated with large wildfires, what some various agencies and departments are doing to monitor air and water quality, and the steps that are being taken to minimize spread of hazardous debris. So one of the most common questions that we get is about the health risks after the fires and what residents should be concerned about, both in the short term and the long term. What I want to make clear is that multiple government agencies at the local, state, and federal levels are working together to figure out the best way to monitor and test the air, water, and soil. The goal is to understand the impact of the fires and any potential health or environmental risks in order to keep all safe. Now, as we go through this, there may be certain things that we don't know now that we'll learn later on as we start to put more things in place. Now, in brief, wildfires do release harmful pollutants like tiny particles, often called particulate matter or PM 2.5. There could be a mix of heavy metals and toxic chemicals, and all of these things go up in the air with the smoke and ash, which can seriously affect your health. Now, these particles are at their highest during an active fire and can stay in the air for days afterwards, raising the risk for respiratory issues, making conditions like asthma and heart disease worse, or irritating the eyes, nose, or throat. Now, smoke and ash can also travel for miles, worsening air quality in areas far away from the fire. So even if you're not close to the fire, smoke and pollutants can still affect your health. That's why we urge residents to check air quality reports regularly. And if you notice during the fire, they were at their worst, and then a few days later, they started to come down, and then they come, pretty further down back to more baseline since that time. But when air quality is poor or unhealthy, everyone should limit activities outdoors. Not everyone, but people should consider limiting activities outdoors, especially if you're sensitive to poor air quality or if you have underlying health conditions. Consider using a mask or an N95 mask if you need to be outside in smoky conditions or you see ash in the air. But in addition to air quality concerns, wildfires can also pollute water, sending ash, chemicals, and debris into rivers and lakes and groundwater, which is often a source for some water supplies. The heat can also damage water treatment systems, making it harder to ensure that the water is clean. And after a wildfire, it is really important to follow the instructions in your local advisories or notices and avoid potentially contaminated water until it's tested and deemed safe. Now, public water systems are routinely closely monitored. And again, residents should stay informed through their local water agencies for any boil water or do not drink, do not use advisories or notices or any safety updates they provide. Now, usually with those, they will give instructions on what to do with the water that may be coming into your residence. And in terms of debris removal, this is really one of the critical steps of recovery, removing all of that was left after the fire. We want to assure that residents, and that this really does follow strict precautions in order to minimize exposures to hazardous materials as well as the fire debris and ash that remain. And it goes in 2 phases. Now, the first phase is led by the U.S. EPA, or Environmental Protection Agency. It focuses in on removing household hazardous debris, such as burned household chemicals, some electronic waste, potentially burned vehicles or batteries in electric vehicles, things of that nature that are immediately hazardous to health. And usually these are common things that will be in the house, but trying to get that up first before the second phase, which is being done by the U.S. Army Corps of Engineers as one option. And that will handle the broader and remaining debris removal efforts. Now, toxic materials and the debris as it's being transported will be in covered, sealed, wrapped trucks with multiple layers of insulation to prevent exposure. As they're doing the work, there are protocols and strategies put in place to mitigate or limit dust being kicked up into the air. And the trucks will follow a designated route to limit community impact. And all contractors must adhere to strict protocols and regulations in terms of removing, transporting, and handling and disposing of all of the debris that gets removed. Regardless of the type that it is, it must follow regulations for public safety. Now, as we continue these efforts, we remain committed to monitoring environmental health conditions and keeping residents informed. And if you have concerns about air or water quality, you can visit our website, publichealth.lacounty.gov, for the latest updates and safety recommendations. Thank you.
Thank you so much, Dr. Davis. That was very helpful information and much appreciated. Our next panelist is Dr. Quick. She's the Chief Medical Advisor for the Los Angeles County Department of Public Health and has extensive experience in environmental health and emergency preparedness. She's well equipped to help residents take precautions and understand what precautions to take to protect themselves and their families. And she will provide some critical guidance on minimizing health risks associated with soot, smoke, and ash when returning to your property, and also some advice in identifying and hiring reputable remediation professionals when professional cleanup is necessary. Welcome, Dr. Quick.
Thank you. Good evening, and thank you everyone for being here today. Since the fires began, we have heard from many folks returning to homes and schools near burn areas that they are confused about what to do to mitigate the potential health risks associated with the fires. As a reminder, fires create significant potential exposure to hazardous materials such as lead, arsenic, and asbestos. If you are living near areas with significant burn during phase 1 of the cleanup, which has already begun, the EPA is going through fire-damaged neighborhoods to remove hazardous materials. While the removal of these materials should not result in significant disturbance of ash and other fire debris, it is prudent to avoid being outdoors near these properties while the debris is being removed. For those returning to homes very close to fire debris and burned buildings, you may decide to delay return to your property until after all the fire debris has been removed from the properties adjacent to yours. This takes place in phase 2 of debris removal. For the hundreds of people who are returning to homes, we know that many of you are concerned about what to look for, how to safely clean, and whether your property might still pose risks even if it wasn't directly damaged. These are very valid concerns, as proximity to burn areas can present health and safety risks, even if your home or school is intact. A suggested first step in assessing the extent of smoke, soot, and ash contamination to determine the appropriate cleaning measures. Understanding how to properly assess your property will help you decide how to address any risks, whether professional assistance is needed, and when you can return safely. When assessing smoke, soot, and ash conditions in your home, the level of contamination determines the steps you should take. If there is no visible soot or ash on horizontal surfaces and no visible suspended particles, and you don't notice any noticeable smoke odor, homeowners do not need to undertake any specific remediation actions. In cases where there is no visible soot or ash, a wipe test where you wipe a wall or windowsill confirming no ash or soot can help determine that there was not significant intrusion of dangerous fire debris. For situations involving light ash or soot on horizontal surfaces and/or visible airborne particles and/or noticeable smoke odors, a more thorough cleaning is recommended. When cleaning, always wear an N95 mask, gloves, long-sleeved clothing, and goggles to protect yourself from exposure. Avoid dry sweeping, as these can stir up harmful particles into the air. Instead, use wet cleaning methods like gently hosing down outdoor areas and wiping surfaces with damp cloths indoors. Ash should be collected in sealed plastic bags and disposed of in covered trash bins. If you notice signs of significant soot, smoke residue, or odors in your home, it is important to assess whether professional cleaning or remediation is necessary. The following guidelines are helpful when selecting a professional cleaning or restoration service contractor. First, if you are filing a claim, check with your insurance company to see if they have firms they would recommend or firms they contract with. If you end up looking for a professional cleaning contract yourself, confirm that the contractor is properly licensed by state and/or county and has the required bonding and liability insurance coverage. Additionally, you can ask the contractor if they work with your insurance company and verify this with your insurance agent. You may also want to check references, check with the Better Business Bureau, and/or follow up with past customers to ask about their experiences with a particular contractor prior to signing that contract. It is also essential to request certifications from the contractor, including company and employee certifications from organizations like the Institute of Inspection, Cleaning, and Restoration Certification and the Restoration Industry Association. Before agreeing to start or paying for any work, obtain a detailed written estimate of the work to be done and the schedule for doing it from the contractor, and do not proceed without one. While indoor testing can be helpful in some circumstances, it is important to know that there are no laboratory tests that can determine if your property is safe, and all lab results must be evaluated in context with environmental conditions at individual properties. It is best to avoid contractors who fail to provide specific cost and schedule details in a contract. Lastly, as you reoccupy your home, continue to monitor your health and the health of your family. Symptoms like coughing, eye irritation, or headaches could be linked to lingering contaminants. Individuals such as children, the elderly, or those with respiratory conditions should take extra precautions to avoid re-entering the home until it has been cleared. And everyone should avoid contact with outdoor areas that have not yet been cleaned. Public Health has more detailed information on sensible precautions on our wildfire website, which you can find at publichealth.lacounty.gov. And you can speak with an environmental health specialist if you call 626-430-9821. Thank you.
Thank you so much, Dr. Quick. And I want to note that phone number, best to call during working hours. You'll be asked to leave a callback number, and somebody will try to get back to you within 24 hours. It's a little more difficult on the weekends because we're doing emergency coverage as well. But thank you so much, Dr. Quick. I'm pleased that we're also joined tonight with Sean McCarthy from the California State Water Resources Board. He's in the LA Regional Office. Water quality is a major concern for many communities, especially in the wake of the wildfires. While the immediate impact on burned areas is clear, many residents in adjacent neighborhoods also have important questions about water safety, contamination risks, and what it all means for their health. Sean is here to provide us with some of the latest updates. So thank you and welcome, Sean.
Here we go. Thank you, Dr. Ferrer, and thank you everyone for joining us this evening. I would like to spend a few moments sharing how the State Water Board and your local public water systems are taking steps to protect the local drinking water quality from these fires. The State Water Board's Division of Drinking Water regulates municipal public water systems and has been supporting the local recovery effort in two ways. First, by guiding local water systems in issuing necessary drinking water advisories post-fire to protect public health. And second, by providing technical support to these water systems as they assess and repair their infrastructure. Now, public water systems can sustain heavy impacts during a wildfire, and the time frame for recovery will depend on the extent of the damages. The fires can cause contamination from open water lines that pull in contaminants and from parts of the water system melting or overheating, releasing contaminants into the interior of the pipes. Systems that experience low or no pressure during the wildfire are susceptible to contamination from benzene and other organic compounds in the water supply lines. Now, from practical experience we have gained from previous wildfires elsewhere in the state, we've developed guidance for water systems on the necessary water quality testing and directed systems to issue drinking water advisories to alert their customers as to how to use or not use the water that's being provided to their homes. All water systems impacted by the Palisades and Eaton wildfires issued a do not drink, do not boil water quality notice to their customers as a precautionary measure until the condition of their systems could be determined, and not because there was a definitive information that the system's water was contaminated. Now, water systems are currently assessing the impacts of the fire on their service areas, making repairs, testing for contamination, and revising or removing their notices as appropriate. Before water quality notices can be lifted, water systems must conduct thorough water quality testing, and contaminant levels must meet all state and federal drinking water standards. Water quality sampling throughout the entire affected service area may be necessary to confirm the water supply is safe for use. This could be done in phases or all at once, depending on the size and complexity of the water system. Also, depending on the size and complexity, the amount of time to complete the sampling will vary. For residents and the public, some things you can do when returning to a residence or business is to first check with your local water quality provider for a current local water quality notice before assuming the water is safe to drink. And you want to follow any notice issued by your local water provider. It will have instructions for using the water safely. Those will be listed on the notice. And if you can operate water on your property, low flow flushing is a common practice that you can use to bring fresh water into your water lines. Continually refreshing water in the lines could help lessen or limit the water quality impacts you may experience. And then lastly, when the advisory is lifted, you will also want to thoroughly flush your lines after the water quality advisory notice is lifted to bring in fresh water back into your home. Now, the State Water Board's website does have a page on the Los Angeles wildfire recovery with additional information on the impacts to water supply and the recovery steps your local water agencies are taking. You will also find links to all of the water agencies in the fire-affected areas where you can find the most up-to-date information on the water supply that is being provided to your home. Thank you and good evening, and best of luck to everybody out there.
Thanks so much, Mr. McCarthy. Our next speaker is Dr. Zhu. She's a distinguished professor in UCLA's Department of Environmental Health Sciences, and she specializes in air quality and environmental exposure science. Her research has significantly contributed to understanding the impact of air pollution on public health, particularly in communities affected by wildfires. We're very lucky to have Dr. Zhu provide insights into indoor and outdoor air quality, the effectiveness of different air filtration and ventilation strategies, and best practices for reducing exposure to harmful smoke particulates. Welcome, Dr. Zhu.
Thank you for the introduction. Good evening, everyone. I know with lingering smoke after the fires, air quality remains a major concern in the affected community. And there's often confusion about what the air quality index truly reflects. I'm happy to share some insights and introduce practical ways to protect your health tonight. So air quality index measures 5 major air pollutants, but in Los Angeles, particularly related to wildfires, fine particulate matter, or PM 2.5, is the primary driver of AQI. Those tiny particles can penetrate deep into our lungs and cause various health effects. So we know AQI reflects PM 2.5 levels, but the lingering smoky smell comes from volatile organic compounds, or VOCs, released during the degassing process. Degassing occurs as partially burned materials continue to emit gases long after the fire is put out. This explains why the AQI might look good, but you can still smell smoke after fires. So how does this happen? First, the smoldering and degassing process after fires emit more VOCs than particles. Second, VOCs are gases, and they diffuse much faster than particles under calm wind. In addition, those particles, they can settle and deposit onto surfaces, while VOC continue to travel through the air. This means that smoke odor from smoldering debris and burned material can persist even when particle levels are low. So if you can smell smoke, you're still being exposed and should take precautions. Many questions comes in, like how do we decide if it's safe to be outside after a fire? Well, first start with checking the AQI. If the AQI is good and you are not near burn zones, it's generally safe to be outside. But if you are within or immediately downwind of the affected area, also check for smoke odors, even with a good AQI. Again, the burning smell means continued exposure. And if you are sensitive with asthma, COPD, or preconditions, or just uncertain, limiting outdoor activities is always a good idea. So to protect yourself, if you're within or near burn zones, stay indoors with windows and doors closed to minimize outdoor pollution infiltration. Filter indoor air with a certified air purifier, including both HEPA filters to take out particles and the charcoal filters to remove VOCs. Meanwhile, avoid generating indoor pollutants. Smoking, burning candles, or frying food can also worsen indoor air quality. If you must go outside, wear a well-fitted N95 or KN95 mask to filter particles, but please note those masks don't really block VOCs. And please do not jogging or cycling, exercising in the burn zones. I hope this helps you better understand the air quality condition after fire and encourage actions to protect your health. I'm happy to answer more questions in the Q&A session. Thank you.
Thank you so much, Dr. Zhu. That was illuminating, and we much appreciate your being with us tonight. Our next speaker is Julia Van
Sí, aquí
Kim.
estoy, ¿me escucha? ¿Me escucha? Hola.
Lourdes, we just need you to sort of mute there. And she's in the North Bay Food Systems Advisor program at the UC Cooperative Extension, focusing on agricultural sustainability and food safety. She has extensive experience studying soil contamination and recovery following wildfires, specifically the Sonoma County fires a few years ago. And she's worked with communities to assess risks and implement best practices for soil rehabilitation. We're truly fortunate to have her here to share her expertise and insights on soil safety and recovery. Welcome.
Thank you, Dr. Farrar, for including me in this evening's panel. And as a resident of a community that's experienced a similar catastrophic urban wildfire, I'm heartbroken for LA. And for those of you who are concerned about the safety of garden produce and soil after these fires, the good news is that there's a lot of things to worry about in a wildfire, but for most people in most places, produce safety after a wildfire is not one of them. And luckily, there's some really simple practical steps that I'll share in a moment that everyone can do to reduce the risk of exposure. So first, it's important to remember that there's multiple pathways by which people can be exposed to potential contaminants, and eating garden-grown produce is relatively low on that risk. Other common pathways are from inhaling contaminants into the lungs, absorbing contaminants on the skin through touching ash, ingesting contaminants from hand-to-mouth action, which is particularly relevant for children who might be playing outside with toys or playing in a garden. And then finally, very low on that list is eating produce that's exposed to contaminants. So there's some easy ways that people can assess factors to consider your own risk. And that includes who you are. so the age of yourself and your family members, your health status and the health status of your loved ones, and the extent to which you have frequent exposures to other environmental health risks in your daily life. You'll also want to take a moment to consider where you are and whether you're relatively close to a burn perimeter or whether you're relatively far away from it and your yard is just exposed to ash from the general environment. And then also for some, they might want to consider when they're finally returning to a site, whether to rebuild a garden that has burned. And that is a different kind of consideration that I'll set aside for a moment. And then also when considering what to do with garden grown produce that's been exposed to smoke and ash, one wants to consider whether you have alternative food sources that are readily available. Because generally, good nutrition is a protective factor. And so generally speaking, eating fresh fruits and vegetables from one's garden is good for our health. But many people don't have the privilege of affording healthy alternatives from the food that they've grown. We can also understand that a lot of other factors are much harder to assess. And there's really limited science to point to answers. So whether potentially hazardous contaminants are likely to get onto and then ultimately into produce is a consideration that's really hard to measure. Whether these contaminants can be easily rubbed off and rinsed off, and whether they're ultimately ingested when produce is eaten. And then what the cumulative risk is for individuals and communities over time. So if gardeners decide it's appropriate to eat the produce, there are simple safety tips to take into account. The first is to protect yourself. As Dr. Quick mentioned, you want to avoid inhaling ash. When clearing ashy surfaces, you want to wear a mask and protect your skin by wearing long pants and long sleeves, gloves, hat, and closed-toed shoes. When you're harvesting produce, it's important to wash hands both before and after harvesting and pre-rinse produce with running water outside to remove any visible ash. And I'd use common sense here so that if produce is completely covered in ash, or if you're very close to an urban burn boundary, then I personally wouldn't eat produce and would recommend discarding it into a yard waste bin. You'll also want to take measures to keep the outdoors outdoors. So before entering your house, remove your shoes, take off those outer layers of clothes, and take measures to avoid tracking ash into and around your home. Once you bring produce inside, you'll want to wash and rinse your harvest, again with cool running water inside. You can remove outer leaves and peel produce with thicker skins or scrub root vegetables. And then moving on to soil safety. For those of you who are concerned about the safety of your garden soil as you're planning to plant for spring or freshening up your gardens, there are some common sense best practices for soil safety that are luckily the same best practices day in and day out as they are for after a wildfire. So the first is to try to minimize kicking up dust in the air when clearing garden beds or turning soil. You'll want to amend soil with compost by adding clean soil to your garden beds, and that'll help dilute any contaminants and help break down any organic chemicals in the soil. You can also contain your soil with mulch to create a barrier between soil and produce. And that can be done with wood chips or straw or newspaper. And then use drip irrigation, which can help prevent upsplash of soil particles to the underside of plant leaves. And lastly, this one's an important one, which is to test soil to understand possible contaminants that may be present, either because of the wildfires, but also because of historical land use that happens in urban areas, or contaminants that may be naturally occurring in the soil. The Los Angeles County Department of Public Health encourages testing soil and water before planting a garden. And the agency has a guide that's available online. It's titled Soil and Water Testing Guidelines for Home and Community Gardens. And in that is a list of both soil testing labs as well as common contaminants of concern to look out for. And so for both people with concerns about produce and soil safety, individuals may want to take extra precautions to reduce their risk if they're exposed, if they're pregnant, if they're caring for young children, if they're an older adult, or have pre-existing conditions. And I also want to underscore that we know good nutrition builds our body's resilience. And so increasing produce consumption, particularly green leafy vegetables grown in one's home or community or school garden, promotes health and nutrition and resilience to chemical exposures. And also growing and sharing food in community is really crucial to supporting ourselves and each other in stressful times. So in closing, while every wildfire is unique, and while science is still relatively new, our study in Sonoma County after an urban wildfire in 2017 showed that there was low risk of harm from produce exposed to wildfire smoke and ash, and that there was a net benefit to eating that produce. For additional resources about post-fire garden produce and soil safety that was developed for this urban wildfire study in Sonoma County, you can visit bit.ly/foodafterfire.
Thank you so much, Julia. That was really illuminating. And we have a lot of questions that came in about
Tenemos
soil,
muchas preguntas que
particularly
están entrando.
gardens. So we're really feel very lucky that you joined us tonight. Thank you, because I know you're from up north, and we appreciate that you're sharing with us what
Con
you've
nosotros
learned
lo que
from
usted
previous
aprendió
wildfires
de
in
estos
California.
fuegos que tuvieron
Our
en el norte.
last speaker
Nuestra
tonight,
última
before we go to
persona
your
que va a hablar
questions,
antes de que contestemos sus
is
preguntas.
Lourdes, si se puede, can you mute? Thank you. Our last speaker tonight, before we go to Martha Arguello, is the Executive Director of Physicians for Social Responsibility in LA. She leads initiatives here on environmental health, climate justice, and community advocacy. Martha has been a leader in environmental health, climate justice, and community advocacy for over 2 decades, and we're very fortunate to have her here. She's going to share her insights on community-driven solutions for safe and sustainable wildfire recovery. Bienvenidos. It's so nice to have you, Martha.
Thank you so much. And I'm going to try in my 3 minutes to address some of the questions in the chat. I just want to acknowledge, all the uncertainty. And when we started hearing the fires, I thought, okay, there will be a disaster after the disaster. And the disaster after the fires is really the level of toxicity that will be in our air, water, and soil. And so much research has emerged in California, what happened in Paradise. And so I just want to say to folks, I will try to also drop in the chat more resources, but I certainly hear and feel your frustration as we have been trying to shift how institutions monitor air quality, how we move upstream, so to speak, to prevent so many of these toxic chemicals that are in our homes, that end up in our water, end up in our bodies. We have 25 years of trying to prevent and eliminate some of these toxins, and it is very frustrating. And I hope all of the anger and frustration that I see in the chat can be channeled into effective policy action so that we make communities whole for the things that they've suffered now, but also begin to think about how we prevent these. So I'm going to really mostly talk about public policy. So we in the nonprofit community and the NGO community have had immediate response by becoming centers of mutual aid and donation centers and distribution centers for everything from clothes to air filters. We've done things like promoting how to make your own air filter if you couldn't afford an air filter, and I believe those will be dropped into the chat in a bit. And so we have mobilized to do that immediate support for communities. We are now mobilizing our own organization. We'll be hosting a webinar for health professionals, because what you have a lot of experts here, but most physicians in clinics will have gotten maybe 6 hours of training in environmental health and will often not know how to answer some of the very sophisticated questions that are in the chat about what happened, who's measuring for dioxin, how far, how far do these things disperse? There is, and I can't give you much comfort because there is a lot of uncertainty. But we need to take that righteous anger and hold elected officials and government institutions accountable. Right now, the EPA at the federal level is under attack. It's being defunded. It's threatened, right? And so we need to protect the EPA, and often we're pushing the EPA to do more. You haven't done enough. This is the moment where we actually have to defend that institution collectively so that they are doing the testing, that the information is coming to us, right? Today there were rumors that all the websites were going to be shut down. A lot of databases that have information may disappear. So even our ability to get more information to communities will be threatened. I know certainly our organization and many others will be working in Sacramento to address many of these contamination issues, but we also need to improve our air monitoring systems. The air monitors aren't throughout communities. If folks are interested in getting their own monitor, there's Purple Air that is setting up, has a really extensive network of monitors. They're not that affordable, but some folks might find them affordable. They're about $300, so they're not that affordable. But we're also working with philanthropy, who's asking, what do you need? And what we're hearing is that people need air filters, people need information, people need funds for sampling, people need funds for whether that's air, water, air sampling, soil sampling, and water sampling, so that they feel safe returning to their homes. And so all of these, and we're also going to be working to hold some of the companies who are driving climate change, who sort of helped create the conditions for these unprecedented wildfires. And these, when it starts coming so close to where we live, work, play, and learn, we have, all of these questions. So, I use the Roseville Aquatic Center. I know that they emptied the pool and refilled it, but because their county health department said they had to. So we should be making sure that those public institutions are being held accountable to doing the testing so that folks, again, feel safe in their own homes and communities. So I did want to talk a little bit. So for example, dioxin and some of these other chemicals, we don't monitor for them. They will maybe end up in groundwater and in soil further down the line. And so the monitoring has to happen now and keep happening. If you're worried about, so today we were on the phone with some researchers and trying to pull together resources so we can actually offer sampling of your vacuum cleaner dust to see what's in it. And things like that. If you're further away, if you're near the fires, you shouldn't be using your vacuum cleaner to vacuum up the soot and dust. But we want to be able to tell people. And so we realize that no one is going to come and rescue us, that we as a nonprofit community that have been working on social justice issues are going to need to step up and work with our housing advocates to protect renters and to make sure that landlords are being made whole, so that we understand that not all landlords are giant, but that renters also need to be protected. We need to work, with communities, traditional Indigenous and Black communities in Altadena to protect them. And we also need to educate folks, don't sell your properties. We want to make sure that as we rebuild in a way that's fair and just and equitable. So for us, we have, like most of the institutions, this was, a disaster that we all had to, sort of stop what we were doing and retool and figure out how to do the response. And so we are in the midst of that kind of response. If you're interested, I can drop some more links to webinars and other things that will go deeper into the issues around air quality. What are volatile organic compounds? What are the things that we should be worrying about? Longer term, I don't know that we know how to answer how much cancer risk we're increasing. There's so much uncertainty about how, and scientific uncertainty about causality and all of those things, that answering those questions exactly is often very difficult, which again makes for more frustration because we want answers, but they're still evading us. And so from a policy perspective, we have our work cut out for us over the next few months to make sure that agencies get the resources that they need, that we defend the EPA, that we hold the Department of Toxic Substances accountable, that we're not taking the toxic dirt from one community and taking it to another poor community, that we figure out innovations about how to do that better. We're meeting with some folks who worked in Katrina, who developed these
Martha,
non-toxic.
I'm just gonna note here.
Okay, I'm over time, sorry.
The-
But we are in this with you and are asking many of the same questions, and hopefully we will be able to answer them, but also mobilize, organize, join organizations in your community. And with that, I'll stop. Sorry.
Thank you. Thank you so much for your passion. And I know there are many on this call who really appreciate the notion that, you know, we've all got to be good advocates right now. And it's important for us to work together to make sure that the resources are going to be there. Supervisor Horvath, if I have some questions that I've heard you speak a little bit about in other settings. So if you don't mind, I thought I'd give you a couple of the first questions
Okay.
that have come through, and I'm just trying to get through as many of these questions as possible. Let me just assure the audience that the questions we don't get to, we will over the next few days try to group them together and post some answers to those questions on our website, and we'll communicate that out. It also could go on the county's website as well, just because we have so many questions. I'm not sure we're going to get to everything. But I think one really important question, and maybe really piggybacks on what Martha was talking about, is what long-term policy changes are being considered to improve wildfire response, better support impacted communities, and reduce future risks? I know that's a lot.
Yeah, well, Chair Barger and I are very committed to making sure that we do a very thorough after action on everything that we should be learning from these fires. In fact, we've already passed a motion unanimously by the board. We will be asking all of the questions and more that we are hearing from the public because people deserve answers. It's not just important for good governance process. It's important for people to understand that we are hearing them, that we're giving them answers to the questions that they're asking, and that they know that we're working to improve all of our systems based on the experiences that we've had. It's what we did with Woolsey. There was an after action report after the Woolsey fire. Many steps were taken to implement recommendations from that point in time. And that helped lead us and get us to a place where we've been for the Mountain Fire, the Franklin Fire, and now all of these fires. So we'll be looking at pre-deployment of resources. We'll be looking at evacuation procedures, incident response, of course, our alert system, brush clearance, and so many other things that have been top of mind for people. That I also brought forward a motion regarding our water facilities and water infrastructure. I know there are questions around that, and all of these questions deserve clear answers. So we're meeting with communities on an ongoing basis. We are making sure that all of your questions and concerns become part of our after action reporting.
Thank you so much. Do you have time? I'd love to. There's a couple of other questions, and
okay,
I know that you've addressed some of this earlier, but there are a fair number of questions around financial assistance that folks are looking for because they're facing a prolonged displacement, particularly for those that have houses that are still standing, but they're in burn areas.
I see.
Where it may take a while before they're going to be able to go back, or they're adjacent to heavily burnt areas. And they're just wondering, are there any opportunities that you've been pursuing to assist with identifying some financial assistance programs that they might be able to access?
Yeah, so before I address that directly, I also want to note that our insurance commissioner has been hearing your concerns about pressures that you've been feeling from insurance companies to get back into that housing. Your house is still standing, you go get a couple of weeks and you got to get back in. Meanwhile, you're trying to assess the health impacts and whether just because your house is standing, are you reconnected to utilities? Is it actually habitable? I know that he is providing from his standpoint support for you to navigate those conversations with your insurance companies. On the county side, we have established a recovery fund that is that goes in a couple of different directions. We have one that is dedicated to small businesses and workers because we know that there are so many businesses and that have been impacted. We want to make sure those business owners are supported, and of course, the workers in all of those businesses are supported. But to your question about people whose specific homes are still standing, but they need that additional assistance, we have seeded a new fund, an LA County Recovery Fund, with $32 million to specifically help residents directly impacted by these fires. And we're working to continue to increase investment. Now, I want to be very clear, this investment isn't going to government services. This isn't to rebuild sidewalks or roads or any of that infrastructure. This is to provide the support and help that people need to navigate this time of recovery and to address some of those ongoing costs that people are encountering while they're figuring out how long this recovery process is going to be for them. And the intent of this fund is really to provide that bridge funding, and you can go to lacounty.gov/relief. On that website, it has all the information about these funds. It spells out what these funds can be used for. And if you have any questions, you can just let us know.
Oh, thank you so much. I think that was very encouraging for many people to hear. I'm not sure everybody knew about that, so thank you for sharing that with us. I am going to shift gears a little bit because we have a lot of questions about safety around children, and some questions related a little bit to schools and school safety. But Dr. Zhu, I thought I could start with you, and Dr. Quick or Dr. Davis, feel free to chime in. The question starts with a lot of us with toddler-age children need to know how detrimental it is for their lung development to resume normal life if we're only a short ways away from a burn zone. Is it safer? Should we be considering moving to another area? Is it going to take years for the air to be safe again? Remember, we all live in LA County, so we know that the air quality varies from day to day. The microscopic particles are worrying a lot of us. So I don't know, Dr. Zhu, if you want to start, and then maybe Dr. Quick or Dr. Davis wants to join in.
Sure, happy to start this conversation. Children, toddler, babies, and they're very sensitive. Their lungs are developing. They're breathing in more airs per unit mass of body mass, so they're really sensitive to those pollutants. Even they're exposed to the same amount comparing to adults. So yeah, babies, toddler, they need to take more precautions during this sort of like cleaning phase after fires, especially families that live close to the burn zones. If there are like cleaning activities going on, I hear Dr. David mentioned there was in the middle of a phase 1. So during phase 1, if there's a suspension of the dust, the ashes, and children likes to play outside, those are really needs to take additional cautious around those situations. And so I would say try to keep them indoors, right? I know this is not the ideal situation, but maybe take them outdoors further away from the burn area to get some playing times. But immediate near the burn zones, I would say try to protect the babies and toddlers and young children.
Thank you. Dr. Quick, I'm wondering if you want to just jump in as well.
Yeah, a couple thoughts on this. I do want to again highlight some of our advice has been if you happen to be going back into an area where you're very close to damaged structures and that, nobody's really gotten to phase 2 cleaning yet, it may be prudent to avoid returning to that area until that has taken place, the phase 2. I also want to just briefly touch on some of the specific guidance around children and ash and dust. We really don't want kids to be coming into contact with ash and dust. So, as much as possible, don't involve kids in any of the cleanup activities. If there's in your home, make sure that kids, particularly those that are crawling around on the floor, putting things in their mouth, making sure that they're not getting into any of that dust or ash, washing toys frequently. If they are out in the yard and there's any ash or dust, make sure to wash hands and take shoes off before coming in. Those are some of the things that we're concerned about because we are particularly concerned about exposures to children. And so we do want to take extra precautions with that.
Yeah, Dr. Quick, if you don't mind, I'm going to ask you another question. I know we've been dealing with this question for the last 2 days, but we have a lot of questions from people participating tonight. It's about sand and sandboxes. So what are the recommendations for sandboxes? We have questions about sandboxes at schools, in areas adjacent to the burn zones, and we have questions about sandboxes that are located further out, a few miles from burn zones, but in yards where people saw some ash and soot.
Yeah.
Not the heavy layer you saw if you were right adjacent to the burn, but there was visible ash and soot occasionally in their yards.
Yeah, I'll start in the burn zone and work my way out in talking about this. If you are in the burn zone, most likely you are not in your home right now. When the process happens where you're going back in there, if the sand is still in a sandbox, I would recommend that be, replaced because you are likely to have had heavy ash and soot impact in the burn zone. As you move out, what we want folks to do is to kind of use a visual inspection, and it could be in the sandbox surrounding area. And if there is ash and soot in sandbox, we do recommend changing that out. If you're well outside of the fire zone and where any of the ash and soot fell, and you didn't see visible ash and soot in the sandbox, you didn't see it in surrounding structures, then you don't need to replace that sand. I will mention, in general, sandboxes are intended for kids. And once again, we take kids and the precautions surrounding them at a different level of sort of risk. So if you're in doubt and you're wondering and you're trying to gauge between heavy ash and, medium ash, changing out that sand in that sandbox is a good idea.
Thanks so much. Julia, I'm just going to flip over to you a little for a couple of questions, somewhat related, outdoors. But this is obviously about soil, and some of them you answered a fair number of the questions, but I see a couple here that I don't think you directly addressed. One is, if I compost yard waste and leaves, is it safe to continue doing so if ash from the fire settled on plants and soil?
Yeah, so similar to the different distances from a fire that Dr. Quick was just explaining, the closer you are to the urban burn boundary and the more ash that your yard experienced, the more likely you want to clean and clear that away and start fresh with your new compost pile. The farther away you are, the less ash you have in your yard, the more likely it's okay that a little bit of ash dispersed on top of an existing compost pile and you continue. So I think for now, if you're doing a fall midwinter cleanup and you rake your leaves, that initial garden cleanup after the fire, I would put that in the green bin, or depending on how close you are to the burn area, potentially bagged in the trash. And start fresh with your compost pile sort of building out in the spring. And if you're farther away, then I think that should be fine.
A follow-up question, which I think I really appreciate that someone raised this, because we're really looking a lot at what's remediation going to look like. If somebody's asking, are there some types of soil amendments or treatments that can help restore soil health after wildfire ash and soot exposure?
Great question. just to stay the most broad and general for the average home, school, community gardener, I'm going to go back to my points, which were to amend soil with compost. That's going to be bringing in fresh, clean soil into your garden, and then to cap it with mulch. And I think those two things are a really great place to start. You can get more obscure in the literature, but I think that just good fresh compost and mulch is a best practice that you can never go wrong with.
Yeah, thanks so much. I know I've been hearing there's a major question that's running through the thread in the chat, which is what do we consider to be near a burned area? I'm going to turn to Dr. Quick because I think she tried to answer this you know, a little bit differently, which may not be satisfying, but in part it is, what do you see inside and outside in terms of ash and soot, and how much you smell smoke? So Dr. Quick, I'm going to go back to you quickly, and then Sean, I have a few questions for you, and I'll follow that with some questions for Dr. Davis as well.
All right, so let me try to clarify a bit about that. And I think it also depends on what we're talking about. When we're talking about judging something like ash and soot impact or impact to an area, if you're within the burn scar, so your house is destroyed, that's very obvious for some of these. There's going to be fire debris all around. There are homes that are within that burn area that are still standing. We would also consider those very, very heavily impacted by ash, soot, and these other contaminants. As you move out from the fire area, like the actual burn area, it becomes harder for us to really quantify that risk, because as the smoke blows out, that ash and soot was deposited unevenly across the county. And so we really need people to be able to look at some of these visual clues when we're talking about the ash and soot to determine whether or not their property was impacted. So that's kind of what I mean by near. If you are directly backed up, so like the street behind you, everything burned on there, and you're right outside that obviously is another area where you may have more impact from that ash and soot.
Yeah, thank you so much. Sean, is there any way to test my water as an individual household?
Sure, that's a great question. We receive a lot of times when residents are concerned about any water contamination they hear about in a water system. If you are concerned about the water quality in your home, the best way to do this is to arrange to have a sample analyzed by a certified laboratory. Now, of course, you would have to collect it and pay for it yourself, but your water provider may also provide this service at a cost to you, or at least help you get in contact with a certified lab. We don't recommend relying on those home testing kits you might purchase at home improvement stores. The data that's provided by those kits isn't comparable to the data the water boards and the water systems that use from a certified lab to make our decisions to deem the water as safe.
Is there a place folks can go to get connected to some of those testing sites that you do recommend, or are you saying just contact the water board or your water purveyor to get help with that, Sean?
The best way is to contact the water boards. Our environmental laboratory accreditation program has a list of all the certified labs, and your water provider will also be able to put you in contact with the certified labs that they are required to use. Yes.
Yeah, that's great. A couple of other questions that, we've received multiple questions on. One is directly for the residents of the Palisades Highlands. They are wondering when the water is going to be okay for them to live in. There are some homes that got burnt there and some homes still standing.
Yes, I think that depends on the water system sampling plan, their procedures they are going through to assess the impact of their infrastructure, identifying the potential for contamination within their service lines, and restoring their water service. Complex systems do take a little bit more time to go through these recovery steps, but I know all the water systems that are impacted are at the stage of flushing and sampling right now. And so it's just a matter of time before we can review and receive those results and make a determination when to lift those advisory notices.
Okay, thanks. Thanks for that, Sean. I think Another question again is, came from multiple people is, are there some steps that residents can take to filter or treat their own water, particularly if they live near burn areas? The water's back on now, but it's coupled with questions about, my water's on, people say it's okay, but it has an unusual smell or taste or color. What should I do? I mean, I think we have a whole set of questions around, I'm coming back, things look a little bit different, smell a little bit different, or taste
Yes.
a little bit different.
Yeah.
What can I do in my house? I know everyone is saying this water is safe, but it's not the same as it was before.
Mhm. I think the first step you could do is follow any advisory notice instructions that it's been issued by your local water supplier. If you're still under an advisory notice, certainly flushing the pipes within your home to bring in fresh water can help lessen or minimize those water quality conditions. Your local water provider could also investigate the water that's coming from the street to your house as well. But then as far as in-home filtration, in-home treatment, if you're under a current do not drink notice, don't attempt to filter or treat the water yourself. Home treatment devices, they may not be able to remove the significant levels of contamination from your water that we have found in past fires. And so we don't recommend relying on those home treatment devices that you may already have within your house to deem it safe.
Yeah, thank you so much for that. Dr. Davis, I'm going to ask you a couple of questions, and other people feel free to jump in, because these are questions, again, I'm taking about 20 questions and trying to turn them into one here. So I'm not going to get this perfect, but a lot of folks are very concerned about how they need to think about their health risk related to the data that we have on air and water, if they are somewhat removed from the burn areas. So these are folks, and I think this gets a little bit to recreational water as well, Dr. Davis. These are folks who are maybe 3, 4, 5 miles away, had some soot and ash, certainly had some smoke when the winds were blowing, but they're not really, at this point, they're not really certain of what they should be worried about or whether they need to take precautions.
It's a good question. And one thing I want to say is, like, when we talk about soot is generally a dark dust. And ash is sometimes, gray and kind of floats around. So when we talk about soot, that's what we're talking about in terms of a dark dust. It usually comes from things burning. So in terms of being further away, I mean, really what happens typically with fires, as mentioned earlier, is the air quality gets bad. And again, it can be bad for miles away, depending on what the weather is, how long the fire has been burning, and all of that. So paying attention still to air quality is important to do in terms of thinking about activities outside and whether you may be at risk for health concerns, depending on what the pollution level is and the air quality index is. So paying attention to that. Definitely, if you were in an area, even though you were miles away, and you did see soot and ash, still following the same directions around cleaning that up safely, protecting yourself, hands, shoes, N95 mask, as well as goggles in terms of protecting yourself during cleanup, especially if it's indoors. Those are important things to do. One thing to think about when you're further away is that stuff that floated in, once you wipe that up, especially if it was light and not really extensive, then that really takes away a lot of your risk of exposure. You may also have issues where you may have smelled smoke inside. Maybe your windows were open and you got, you see floating ash inside, or, something of that nature. Considering using air purifiers inside can also help improve the indoor air quality and take out particles that may be in your house, not just from the fire, but in general, even with outdoor air pollution, if that happens as well. So those are the things I would consider. In terms of thinking about recreational water, and I'm assuming, Dr. Ferrer, a lot of this is related to beaches. And as many of you know, a lot of our beaches, after we got the rain, water and all the chemicals and other things in the streets and debris and other stuff, flowed into the storm drain and ended up in our oceans. And we do have an advisory to close the beaches, and there's efforts to clean that up. But really paying attention to the ocean water beach advisories will give you a sense of what's happening. There's often routine testing, especially after rains, to see whether or not there's lots of things that pollutants that would have floated into the water that change the bacteria level that tells us that it's contaminated in some way. So those are important things to watch out for just in terms of those advisories. And then again, visually paying attention to what's around you and trying to clean that up where you can.
Yeah, thank you so much, Dr. Davis. We also have questions that came in from people who, really tragically are dealing with homes that have been completely burned. And folks are asking, how much exposure will I have if I go and try to sift through the debris? Because I'm looking for some of my valuables or to see if anything got left. And there's a second part to that question, but we'll start with sort of what should people do if they want to sift through the debris, or who should sift through the debris, or should no one sift through the debris? I've got like questions from lots of different people about sifting through debris.
So I'm going to answer this question pretty directly. And I recognize that everybody's going to make judgments on what they decide to do in this. And so I would say if you are going to do it, maybe the best scenario is going to be after hazardous materials have been removed. So after the EPA is going through and removes visible hazardous materials, which could be, gas tanks, it could be, electric batteries that were heat damaged that pose a potential risk. It could be other chemicals, paint cans that are sitting around as well. Having that stuff removed decreases some risk. Adults should be the ones, if anybody's going to go. I do not recommend that children or pregnant persons be there. They're definitely more sensitive to pollution. And just remember, you're walking into an area that hasn't been cleared of all of the debris and hazardous ash, dirt, soot, and everything else. And so you're walking into the pile. If you are going to do that, and definitely don't let pets run around, in that as well, because that'll contaminate them as well, potentially contaminate your car or your house. In general, if you're going to do that, you want to be most protective in terms of trying to keep from inhaling any of the ash that gets stirred up as you may be walking through or digging through the ash. So wearing safety goggles, wearing an N95 or P100 respiratory mask to prevent inhaling particles if they are in the air as you're going through stuff. Wearing gloves, preferably wearing sturdy shoes, and preferably having a Tyvek suit, which is basically a full body, covers your head as well, and some shoe covers would help in terms of reducing any contamination of your clothing as you do that. Now, when you're there, it is very important to look for hazards, not just in terms of if you're putting your hands in that, but even as you walk. Remember that there were things there. There may be some sharp objects that are hidden. So you have to be very careful. If you are going to try to sort through gently, maybe even mist, probably best to mist the area that you're going to try to go through, using a hand tool to lightly move things around would be important as well. That way it reduces the risk of stirring up the dirt and dust and potential exposure from that. And also, as you get things, really try to put them in a plastic bag or a container with a lid. Try to clean them off before you take them in the house, just to try to not bring whatever they may have been sitting into the house as well. So that's the initial thought. And I would say that, for those who are going to look for personal items, in phase 2, all that stuff is going to get picked up. That's why I say, phase 1, if you can go and get through that, that does take away at least some risk, but you're still going to have some risk, and there will be some hazards when you go in. So using those things can try to help reduce that risk. And then, of course, when you get back in the car, try to not have those contaminated items in terms of what you wore. Get in the car as well, at least try to dust off, use baby wipes or something to try to wipe them off to reduce what you get into the car and what you may take into the house.
Yeah, thank you so much, Dr. Davis. And I want to just remind folks that we continue to distribute protective gear, including Tyvek suits, goggles, masks, and gloves at both disaster recovery centers. There'll be one in Altadena, and there's one on the west side at UCLA. We also are distributing them at the Santa Monica parking lot number 3, where people are going to get their passes to go up into some of the burn areas. And we have 2 other sites in parking lots in Altadena where you can pick up that protective gear. So, we're recommending protective gear for everyone who is returning to homes in the burn areas and adjacent to the burn areas. As many of you in homes that are adjacent to the burn areas are going to be doing some cleaning, and as you've heard all night, if you are going to be cleaning, we really strongly recommend you use all these precautions to try to avoid any contact with your body and the ash and the soot. And also, of course, try not to breathe anything in, which is why we're asking you to use those very tight-fitting, because they have to fit tightly to work, respirator masks, the N95s or the P100s. I want to just have one quick question, Dr. Zhu, if you don't mind, because I think lots of people are also curious about this. They've gone to the AQMD site. They're looking at the AQI. They're trying to use that information to determine whether they should wear a mask or stay indoors. And they're wondering what they should be looking at. The overall AQI, should they be looking specifically at the PM2.5 level? And if they are looking at the PM2.5 level, when it's over 40, is that when they should get concerned and start wearing a mask? So I think some folks are just looking for help interpreting that data.
Yeah, this is a great question. I briefly mentioned that AQI include 5 major pollutants, but most of the time we're in Los Angeles, ozone and PM2.5 are the key pollutants that we're dealing with. So oftentimes our AQI reflects those pollutants. And related to fire is the fine particle PM2.5. So when you go to South Coast EQMD's website or EPA's Air Now, the AQI mainly reflects the major pollutant, the most important pollutants in the region. So PM2.5 is the pollutant that we're most concerned about during fire and after fire, and just in general LA pollution. So AQI for PM2.5 and whether PM2.5 is 40 is something that was concerned. I think there's also another aspect because of time I didn't mention completely, is the PM2.5 is also just a mass-based concentration standard for EPA. And that didn't really reflect toxicity of the particles that is associated with the mass concentration. So during fires, there are evidence showing those fire particles are more toxic per unit mass comparing to just regular urban pollution. So I think it needs to be more on the precautious side when you're, see AQI is sort of in the borderline between green and yellow and orange to make decisions. And also the decision also related to the individual, whether you are sensitive or your loved ones are sensitive peoples, and those including children, we already talked about, pregnant women, elderly, people with preconditions in the respiratory system or cardiovascular system. So those people needs to be more on the precautious side. And I also want just to mention that really depends, I think a couple of panelists mentioned, depending on how close you are to the burn zones. Right now, the fires over, and the main issue about the still emissions coming from degassing and the smoldering process, right? So if you are far away, by far away, and given a typical Los Angeles meteorology, you're a couple of miles away from the burn zones, I think you don't really have to worry too much about what is really coming out from the smoldering and degassing. You are really just worrying about the general air pollution in LA. So AQI could provide a good indicator about the general air quality in LA. But if you are in the burning zone, those degassing and most smoldering is still gonna add to the ATY concern. So you want to make sure the smoke, the odor that we keep saying, if you smell it, then there's something going on. You need to be more careful about it.
Yeah, thank you so much. I'm going to just close by giving a little bit of information of next steps around monitoring, because we did get a lot of questions about who's monitoring and for what. We have brought together the state, the federal agencies, and some of our scientists from universities across the country to really discuss coming up with a public-facing monitoring plan that talks about what monitoring is going to be happening here in LA County: outdoor air, indoor air, soil, and water. And our commitment to you is we are trying to gather information from all of the folks who either are doing some monitoring already, are thinking of doing some monitoring, or have some obligations. As Sean noted, we have monitoring that's done all the time about both water that goes into people's homes and businesses, as well as we do a lot of monitoring around recreational water. So we are going to pull together information on how much monitoring is going to be happening. We have a lot of questions about what the long-term monitoring plans are going to look like. And we are going to talk with all of you about plans for creating a dashboard so that everybody who has a piece of that monitoring, because, you know, this is a complex system of folks who have interest and obligations depending on their purview and regulatory authorities for monitoring. We're going to try to put it all in one place on a transparent dashboard. For those of you who have been looking around for what has been happening in other jurisdictions where they've had large fires, we're working very closely with Hawaii, because Hawaii has done some excellent work on really being able to partner closely with community residents and workers and institutions and government to be able to share data openly so that folks have the kind of information they're looking for to answer questions over the long haul. Because I think many of you did raise questions like, what's going to happen to us in a year? What's going to happen to us in 2 years? What does it mean if we had these exposures? We have questions from people who went back, cleaned up already before they saw our guidance, before they had access to the PPE that was distributed, and they too have concerns. So please, we will stay in touch. We will do more town halls with you, but our commitment is to come up with a countywide monitoring plan that we're able to share with everyone, and that we're able to also be able to use that information so that you can see the information and have it help all of us answer questions around what kind of remediation will make sense as we continue with the recovery process. I want to thank, most importantly, all of you who joined us, all of you who submitted questions. As I said, we will be grouping these questions and trying to get answers to them. They are likely to show up sort of in the way we try to answer these on our frequently asked questions and answers documents. You should be seeing some of those answers coming out next week. And we will also be staying in touch with our panelists. I think we had a really esteemed group of folks here with us tonight. I'm grateful to everyone who joined us and shared their wise counsel with the residents and the workers across the county. I want to close lastly by thanking our courageous leadership team at the county, our supervisors, our board of supervisors, Chair Barger and Supervisor Horvath, and their teams for continuing to guide this county through these challenging times. But with that, we wish you good night, and we will keep you in our thoughts and our hearts as we move forward.